Hello and good evening. Thank you all for joining us virtually tonight for Jesse Tree's first annual event, Housed for the Holidays. I'm Karen Lair with KIVI Idaho News 6, and I will be your host for this evening. So, to start things off tonight, please enjoy a few minutes of jazz from local band Kitchen Syncopation. Oh, that was so fun. A nice group there. So, our big thanks to Kitchen Syncopation. That was amazing. And we're going to get to hear a little bit more from the band towards the end of the evening. Now, please welcome Amy Larson, who is our guest artist for this evening's event. Amy is a local writer and freelance business nonfiction editor turned self taught artist. She's written for Territory, Eagle, Greenbelt, Edible Idaho, and Idaho magazines. And after years of working in the writing world, she transitioned to art in 2015. Through her business Paint Box, she's taught more than 3,500 Treasure Valley residents to paint and now sells fine art commissions online at her recently established Celebration 7 gallery. So, welcome, Amy.
Thank you.
Looks great behind you. So here's how this is going to work tonight. Throughout the event, Amy is going to be creating a painting on the theme of home. And then at the end of the event, that finished piece that she's working on right behind her, that's going to be auctioned off. So you at home will be able to bid through the chat feature on the YouTube stream. So you can participate in that bidding process by signing into your YouTube account and chatting in your bid, which will start in the auction in less than an hour. So Amy, you got a lot of work to do. You can go ahead and get back to work, and we'll check in with you in a little bit.
Thank you.
All right, now we're going to hear a few words from Nick Schleckaway, former Boise State football player and owner of Amherst Madison Real Estate Company in Boise.
Good evening, everyone. This is Nick Schleckaway with Amherst Madison, coming to you on behalf of Jesse Tree and this fantastic event that we have for you this evening. It's my honor and privilege to support Jesse Tree in their mission to prevent homelessness. In all my years of working and living in the Treasure Valley as a student athlete, as a firefighter, as a real estate agent and broker, and now as owner of a real estate brokerage here locally, I don't know that I've ever run into a concept or an idea more important than home, more important than the safety and security and stability that comes with the concept of home. You know, it's something that everybody deserves a chance at. We all seek, we all yearn, we all want deep in our hearts to be accepted, to be at peace, to have those opportunities. And it is absolutely critical that we keep people in homes and get them in homes if they're not. We've had a lot of challenges this year in our economy because of COVID and because of the economic fallout of COVID. One of those is homelessness, which is drastically on the rise. And this is a very, very important concept for our community, a very, very important cause for our community, and it's my honor to be here to support everything that Jesse Tree is doing. So first and foremost, I just want to say thank you for being here. Thank you for coming. And I want to introduce a quick video actually that Jesse Tree put on in partnership with Leadership Boise that explains what they do, that explains their mission, and I hope that you enjoy it as I know I did. Thank you.
To me, Jesse Tree is definitely a lifeline whenever you're struggling, especially in the Treasure Valley.
I'm Allie Robbie. I'm the executive director here at Jesse Tree, which is a nonprofit dedicated to preventing eviction and homelessness in the Treasure Valley. We support low-income tenants at risk of eviction and homelessness and get them through their housing crisis so they can stay in their home. Essentially, our mission is to keep our neighbors housed.
Price is going up so much. People that are trying to do it as single families are having a hard time because they need that second income to accommodate for how the rental market's going right now. I have been a citizen of the Treasure Valley for about 28 years now. Last year, we came into a position where my husband was down on work hours. I was just getting out of my semester at school, and we came to a spot in the road where we could either pay our rent or we could pay our bills.
We see so many people who've had just a temporary blip in their life. They lost their job, they had a healthcare bill, childcare bill, whatever it is. Life just happens sometimes, and people need a little bit of support at a critical point in their lives, and we can do that. And that's something we as a community can do right now.
My name is Kimberly Sanchez. I am a mother of 2 girls, 4 and 6 years old. They are a goofy pair for sure. I worked with Jesse Tree first time back in 2013, right before I had my first daughter, and they were great during a hard time at that time. And this second time around, COVID just definitely affected everything, and I'm sure a lot of people's lives. Work got cut. Knowing that my girls are safe and secure is something that every mother wants to feel and not have to worry about having to be out without a roof over their head.
We are in a pretty urgent situation in the Treasure Valley right now in terms of the housing crisis. Ask anybody living outside how they ended up there in the first place, and you'll hear the same story over and over again. People had a difficult month or a year. They got in a place where they couldn't pay their rent and got evicted or lost their housing, and here they are months or years later still living outside. Once a family becomes homeless, it's incredibly difficult to get out of that situation, especially with an eviction record. So we do need to really continue to get ahead of this problem, and it's going to take us doing it person by person, family by family.
I was able to get the resources so my kids could celebrate Christmas, my kids could, just have a normal type life.
Once I got the help from Jesse Tree, I felt like weight was lifted off of my shoulders, and I didn't have to worry about if my children were going to have a place to stay.
Our success rate is incredibly high. We know that over 97% of the people that we've helped with rental assistance over the past 3 years remain in housing and haven't gone to shelter. It's still not too late for the Treasure Valley to solve for homelessness, but we do really need to keep investing in prevention and keeping people in their homes before homelessness happens to them.
Well, certainly a lot of people in the Treasure Valley can relate to the messages in that video. So a big thanks to Emily, Ben, Julie, Kathy, Amber, Chris, Pamela, Kirsten, and everyone from Leadership Boise who helped put that together. All right, well, you saw her in that video. Now let's welcome in Ali Robbie into the conversation, Executive Director of Jesse Tree. Hi, Ali.
Hi, Karen, and hi, everyone. Thank you so much for being here and just welcome. We couldn't have accomplished anything this year without your support. I know we have a lot of staff, board members, donors, and just members of the community on this call. And we're really excited to have you and just share our accomplishments with you, as well as just kick off the holiday season. So as some of you know, this year I was supposed to do a TEDx talk in person to talk about preventing eviction in a housing crisis. And we ended up recording it at the Idaho Shakespeare Festival venue. We had hoped to show it to you today, but unfortunately that recording wasn't quite ready in time. And so I have the great pleasure of doing a live presentation with you, specifically focused on Jesse Tree and the Treasure Valley. So it'll be a bit of a TEDx mix-up, but I'm excited to share specific Jesse Tree accomplishments with you and provide you an opportunity to learn more and ask questions. So you heard a bit from Kimberly today, and she was one of the clients that we were able to help this year. She was an at-home healthcare worker, has 2 young children, a single mom. The father is not really involved. And our rental assistance, around $1,000, provided her that critical support that she needed at a point in her life that was really, really where she needed it the most. We've seen a lot of people like Kimberly this year. More and more people out there are struggling in the Treasure Valley, while the cost of housing has continued to increase at an unprecedented pace, and we continue to experience population growth and struggle to keep pace with housing needs in the community. You can see in these graphs the breakdown just showing the dearth of affordable housing in the community, that light blue, and how the number of rentals available under $900 has really decreased over the past several years. While housing costs have increased, meanwhile, the cost of other essential expenses like childcare and healthcare have also increased, and wages aren't keeping up. So as a result, the gap between income and basic essential expenses continues to grow. This is why 2 out of 5 people in the Treasure Valley can't come up with $400 in an emergency, why 3 out of 5 can barely pay their monthly bills. And I'm sure you can think of a time when you had a $500 expense come up that you weren't planning for, maybe or it was difficult for you, maybe it wasn't. Almost half of the people in our community couldn't cover an expense like that. It's why any unanticipated expense or shortfall, like a traffic ticket, doctor bill, or job loss can easily lead to an eviction and potentially homelessness. This is why there are now consistently around 20 eviction court hearings in the Treasure Valley each week. You can see how this has wavered over the last year, and I'll talk a little bit about what we've done in eviction court in a moment. But a majority of these evictions are happening simply because people can't pay their rent. We expect these numbers to increase when the eviction moratorium ends on January 1st. The eviction moratorium has helped a bit, but the cases really haven't let up. Alongside the increased cost of housing and eviction numbers, we've also seen the number of people experiencing homelessness increase this year in the Treasure Valley. Over 3,000 households and around 4,500 individuals have been served in Ada County shelters. And these are households who are becoming homeless for the very first time in their lives. And we'll talk about this with Dr. Pate, but becoming homeless is really, it really impacts health in a lot of ways. This really isn't a coincidence either. Homelessness and eviction are a housing affordability problem at the root. Rising cost of housing is really the root cause of the rising eviction and homeless numbers in our community. A large majority of people in our community are requesting rental assistance due to issues related to job loss, we know. Others have experienced some other unanticipated expense or shortfall. Our data really shows that eviction and homelessness are happening because of an unanticipated financial burden. And virtually anyone could be susceptible to eviction and homelessness given the right set of circumstances. Thankfully, we know that there are short-term cost-effective solutions that work to prevent eviction and homelessness, and that's what we do best here at Jesse Tree. We know it works: financial assistance and supportive services. These two interventions together have been shown to reduce housing loss around the country and locally. Over 97% of the clients we've served over the past few years remain in housing here at Jesse Tree, as I mentioned in that video. So we know it works, but because we're in a housing crisis, we have far more people requesting our resources than we can support, unfortunately. This is especially true during a global pandemic where the cost of housing has continued to increase while many people are remaining without work. Requests for rental assistance on our housing crisis line went up 300% during the pandemic and have remained high at that level. Our operations manager, Cassandra, who is on this call, has done a really great job. She did a great job transferring our phone line remote in April when our call volume really spiked. And we recruited around 20 community volunteers, many of whom are also on this call. And they have served hundreds and hundreds of hours on the housing crisis line, providing people with information, support, and referrals to community resources throughout the year. They've done an amazing job. We are so grateful for everything they have done. And the reason people are calling our housing crisis line is because they want financial support, but because we have far more people requesting our resources than we can help, it is really difficult to decide who gets what resources. We would love to help everyone who comes through our door, but if we did that, we would run out of financial resources just in a few days. So we've come up with a system to make sure that we prioritize our resources for those at highest risk of eviction and homelessness, and that we care for our most vulnerable neighbors first. And I talk a lot about that system in my TEDx talk, and I encourage you to check that out when that recording is released. But essentially, we know if somebody with a strong employment history and family ties calls us, they can probably resolve their situation with just a little bit of information and support, and tips and tricks on how to set up a payment plan with their landlord and how to communicate with their landlord. Individuals who have a history of eviction and homelessness and financial insecurity, people who are being summoned to eviction court or who have a 3-day notice may need more intensive support. And so those individuals are served by our emergency rental assistance program. So with our emergency rental assistance program, I just want to give a shout out to our staff. Evan, Nick, Patty, Morgan, Kendall, Cass, Katie, and Shauna for all the work they've done this year. It was really a huge lift, and they've done an amazing job. So grateful to everything they've accomplished. This is really our bread and butter, and we've been able to support over 360 families this year with rental assistance, and we're really proud of that. We've also almost over doubled the amount of rental assistance we've been able to provide this year compared to last year, as well as the number of individuals and families. Last year, we were able to support just around 500 individuals. This year, we've served over 900 individuals. We think that will more than double our last year numbers. Same with the amount of rental assistance that we've paid out. We are serving a lot of families in eviction court, and we anticipate that we will continue to serve more families there, especially when that federal moratorium ends in January. Our legal interns are actively reaching out to everybody who has an eviction court date and asking if we can help. So we're being very proactive, and we've been able to intervene with 35 families through court with rental assistance and many more with support and mediation. And we think with our legal interns now have a really good process set up. We've got really good relationships with the courts. We think we'll be able to serve even more next year. We also continue to use our badge program to provide education and information to tenants, landlords, and partners in the community, offering trainings on financial literacy and budgeting, mediation, tenant and landlord's rights. And we've been able to have about 5 people attend those each week, and we think that program will continue to grow next year. So just a bit about the bigger picture for tenants. What we offer is essentially housing. We're ensuring they can remain stable at home. We know that without a stable and safe home and place to sleep, shower, prepare food, or gather with loved ones, it's nearly impossible to do anything else. And I won't talk about this in detail right now because Dr. Pate and I will discuss the social and health impacts of housing loss shortly. But we know that housing is really critical for health. For landlords, they're really happy to work with us because we're providing them with a solution. We pay them, and they save money from the cost of unit turnover. And for our community, we're saving a lot of money. Housing loss is really expensive for a family. It costs over $5,000 on average for a family to find a new place to live after they've lost their home. The community incurs costs too. On average, it costs our community upwards of $50,000 per year per person who's homeless, which taxes our healthcare system, emergency responders, and nonprofits. In comparison, it costs us about $1,000 to keep a family in their home in rental assistance. We're also working towards unprecedented collaborations. We are working on a campaign to end family homelessness with our public-private partnership, Our Path Home, and many different agencies and nonprofits. And we are the dedicated prevention lead agency in Our Path Home in the campaign. We're really seeking to ground our programs in best practices and research and be a national thought leader as well as a local leader in changing the conversation around how we prevent and end homelessness. So we are really proud of what we've accomplished this year, and we're really excited about what's to come. But there definitely will be challenges. We are certainly concerned about a looming eviction crisis, as I'm sure many of you are. We are underwater with requests for rental assistance right now. Requests went up 300% during the pandemic. That hasn't let up, and we anticipate it will go up when a state rental assistance fund and that moratorium ends within the next month or so. We're concerned about what the need for resources will look like then. We're also missing quite a few people who need us. So I showed you the number of folks going to eviction court and the shelters becoming homeless. Despite all of our efforts, there are still hundreds of families who are showing up there without contacting us first. So we're going to need to do a lot of outreach and marketing to target our resources at the families who really need it the most. So we may not have the immediate power today to raise wages, and make housing more affordable. But on an encouraging note, we can deploy resources to help our community's most vulnerable families. And this is something each of you can do right now. Just a few things you can do. I definitely encourage you to listen to your neighbors, friends, family, coworkers. A lot of people are struggling right now and may be afraid to ask for help, but maybe you could be that help for them when they need it the most. Definitely encourage you to donate or volunteer to housing nonprofits. I know many of you on this call already do that, but continue to do that. That really helps a lot, and we're able to help more people the more support we receive. Get involved in neighborhood associations, local and state government to advocate for housing supports and affordable housing solutions. And maybe consider ways you can increase our housing stock. We definitely need more bedrooms, more tiny homes, just more apartments and rentals in general, which will hopefully over time decrease the cost of rent. We need more housing stock, and maybe you can help with that. So eviction and homelessness really could happen to anyone right now. Maybe all our neighbors need right now is a hand up during this really critical point in their lives. And if that means more of our neighbors like Kimberly, who we talked about, can stay in their home, and we've done it at a lower social and financial cost, that is really a big win for her and for the community. So thank you for allowing us to do this work. We really could not do any of it without your support. So let's keep preventing the traumatizing and life-altering experience of eviction and homelessness from happening to our community.
Well, such an important thing that you guys are doing, and you're doing a great job at it. But of course, more help from the community, the better. So thank you, Allie, for all of that information. And before we get into our big discussion this evening, let's quickly just check in on our live artist tonight, Amy Larson. I'm sure making great progress on that painting. It looks beautiful, Amy. Good job. All right, we don't want to interrupt your workflow too much, so you can go ahead and keep painting. We can't wait to see the finished product here in just a little bit when we get to the auction. But first, let's get to our very important conversation tonight that Allie mentioned there in her presentation. So we all know that this has been an absolutely crazy year, and the housing crisis has tied in hand with the health crisis. So on one hand, the pandemic has caused many people to get sick, while the need to socially distance is causing other mental and social impacts. At the same time, the housing crisis has continued on and even worsened, while many have remained without work. Still, housing is critical to keeping people safe, not only from the virus, but other health impacts. There is a strong relationship between housing stability and affordability and health outcomes. So we are going to talk in depth about that tonight. So here to join the discussion is Dr. David Pate, former president and CEO of St. Luke's Health System, and Allie joining the conversation again. And Dr. Pate, you have been very vocal on this issue over the last couple of months, and we appreciate all of the information and everything you've done to inform the community over the last few months. So thanks for being a part of the conversation tonight as well. So we'll get started with you, Dr. Pate. What impacts has COVID-19 had on all aspects of health this year?
Well, you're right. COVID has exposed all the problems that underlie our American healthcare system. We have seen the vulnerability of our elderly. We've seen the vulnerability of our homeless. We've seen the vulnerability in shelters. We have seen that COVID has disproportionately affected those that are socioeconomically disadvantaged. So it really has just exposed all of the areas of inherent healthcare inequality in our country.
What about mental health? What impacts are we seeing there?
Significant. It is even before this, before COVID, we know that in the United States, we don't manage mental health very well. So I think COVID has just, again, exposed that and made it worse. In fact, I think it'll be a little bit of time before we actually know how bad it made it, because certainly we fear that the physical separation that we have issued as guidance to decrease the transmission of the virus has, in many cases, resulted in social distancing and where people have become isolated. And we've seen this play out in a number of fashions where perhaps older folks who live alone, who would have seen their families on a more regular basis if it weren't for COVID, had changes to their health status that didn't get noticed for a considerable amount of time until a family member noticed something on the phone or a Skype or FaceTime call, something like that. One of the big things that's very important for a family member or friend to notice is early changes of a stroke, changes that we can see in the face and speech and thinking and so forth. And if a person is having a stroke, but they're alone, they very well may have no idea. And so we lose that ability of somebody to identify there's something wrong with mom or dad and we need to get help. I think the other things that really we speculate, but we don't know how bad this is, what has this done to children? What has this done to exacerbate underlying depression? What has this done? Has it increased drug use? We suspect it has. Has this increased suicide rates? That data typically follows quite a while. So it may be a while till we know just how badly this has impacted people. And it's not that we're helpless. Even with COVID, there's things that we can do. We can help make shelters safer. We can help people who don't have food security to have food. We can help people without housing security to get housing. We can help interact with people who may feel socially isolated with our phone calls, with our FaceTime, even visits. My daughter brings my granddaughter by my house, and my wife and I go out and stand on our sidewalk. She stays in my daughter's car, and they roll down the windows and they talk to us. Interestingly, my little granddaughter's 7 years old. And I'm a little bit hard of hearing. And my daughter said something to me I didn't hear. I took one step forward, and my little granddaughter in the back seat said, 6 feet, please. But there's ways that we can still interact. Yes, nobody likes this, but we're not helpless. There's still things we can do.
Yeah, there's a lot that's out of our control right now, but we can still reach out in just different ways this year.
Exactly.
But, Allie, we want to bring you into the conversation here because we are also seeing the pandemic having a lot of impacts on housing, right?
Yeah, and I talked a little bit about the growth in the housing market just now, so I won't belabor the point, but we have seen just continued growth here, and we think that a lot of that is happening because of the ability to work remote, and more and more people from out of state can move here and work here easily. A lot of others are maybe just reevaluating priorities in life and wanting to move to a city where things are affordable. Boise, Treasure Valley is just an amazing place to live. And so, but obviously with increased growth comes increased demand for our resources, and housing is one of them that is a scarce and limited resource, particularly affordable housing. And that's definitely been a challenge. One additional thing is that we've seen the number of available rentals decrease because with all the folks moving in, a lot of landlords are selling the homes that they were previously renting out to homeowners. And so that's one less rental on the market that somebody can live in.
I know, I'm sure we've all probably seen it in our own neighborhoods. As soon as something goes up for sale, it's sold. And a lot of times it's from people who are just moving here because secret got out about how great this community is. So more and more people moving to the Treasure Valley. It has a lot of impacts there. So let's talk a little bit more in depth about the links we see between housing and health. So Dr. Pate, I want your input here. What are your thoughts on different social determinants of health? What can determine someone's health?
You know, that's a great question, Karen, because we realized this even before COVID. When we look at what are the things that affect somebody's health, what's going to determine what kinds of health problems they are going to have, that are going to face, and what their outcomes are, we certainly know that healthcare providers, healthcare systems like ILED, we play a role, but it's very humbling. We probably account for about 10% of a community's health. Uh, then you look at things like genetic inputs. Obviously, we know there are women that are increased risk for breast cancer or ovarian cancer because of genetic traits. There's many other genetic traits that can affect somebody's health. But then there's this whole big category, which really is the predominant factor of determining what is going to be the health of a community, a person, their longevity. And it's things like education. It's things like employment and finances. It's things like crime. Obviously, if you live in a high crime area, that affects mortality, that affects morbidity. It's going to be things like the actual home environment, having housing. Lots of studies correlating not even just the lack of housing with healthcare outcomes, but housing insecurity, housing where they're not stable. They may have housing this month, they may not have it again for many more months. So all of those, and even the quality of the housing, and of course, oftentimes when there's issues about quality of housing, there's also issues about the quality of the neighborhood. All of these things play a role. Let me tell you one quick story. I was talking to a colleague of mine that runs another health system in the southern part of the United States, and they had this woman who was a diabetic. And diabetics, certain diabetics, not all, but certain that require insulin, if they get off their insulin, they can develop a very life-threatening condition. And so this lady got admitted to the hospital. They got her under control, sent her home with the medicine, and she got admitted again about a week later. We're talking probably $5,000, $6,000, $7,000 hospital stay. And she came back, and this kept repeating. And finally, they sent someone to her home to look at the home and see what was going on. And you know what the problem was? It was a $75 problem. She didn't have a refrigerator. And if you don't have a refrigerator, I mean, I think a lot of us just assume if we go to anybody else's house, we know they're going to have a refrigerator. This woman didn't have a refrigerator. And guess what? You have to keep insulin in a refrigerator. So what would happen is when she couldn't afford the insulin, she didn't get it. When she could afford the insulin, she thought it's just going to go to waste because I don't have a refrigerator. So she didn't get it. So instead of us addressing that issue, that she doesn't have a refrigerator, we kept on providing $5,000, $6,000, $7,000 worth of care to her repeatedly. When actually the solution was we went and got her, or they did, they got her one of those little small refrigerators for like $75, and that took care of the problem. So there's so many ways. Another way to think about this too is without housing, think of our own food. Think about where is your more nutritious food? Is it in the refrigerator or is it in your pantry? If you're homeless, you have access to things like in your pantry, processed foods that won't go bad, not nutritious food. The nutritious food is in our refrigerators. And so there's just so many correlations between housing and health, not to mention, you asked earlier, Karen, about mental health, the stress, the anxiety, the traumas that people without housing are often subjected to. And let us not think this is limited to adults. There are health consequences to children. Children are very resilient, no question about that, but they still can get anxious, traumatized by some of the things that go on. If you're a teen and you're homeless, much more likely to suffer a teen pregnancy, which can have a big impact on their life, much more likely to engage in illicit drug use. So there's so many connections, and the association between these two things is very significant.
Absolutely. A lot of links there. So, Allie, what do you want to add to that conversation about those connections?
Yeah, just a couple things to add. One is I really like that story, Dr. Pate, about the woman with the insulin. I think that just shows, I mean, we talk about prevention a lot at Jesse Tree and the importance of prevention and keeping someone in their home. But I mean, it definitely just the health example really is a good analogy for that. That same concept of prevention and how cost effective and important it is to really identify the root of the problem before it gets that emergency expensive situation.
Mm-hmm. Yeah.
But yeah, I definitely agree with everything that you said about the importance of housing and the link between housing and health. We've seen a lot of research come out about how housing insecurity of any kind causes trauma and mental and physical health impacts that can last a lifetime for people and for kids. On a personal note, before, I am from the Treasure Valley, but I worked in the Bay Area in housing and homelessness and worked with a lot of people who had been living outside for decades because they've had such a huge problem there for so long. And no matter how somebody ended up in that situation, there's just a huge health difference in, from on the mental, social, physical level when you meet somebody who's been living outside for 20 years versus somebody who's been out there for 1 year or 6 months. That the impacts of that living in a shelter or a car or any congregate setting has on somebody, it's really, really terrible. And so that's just my personal anecdote there. Talked to several people who had been out there for way too long, and at some point it just gets really, really difficult to get back on your feet. So prevention is really, really key to all this, I think.
Yeah, and organizations like yours to help out before it gets to a case where they've been out there for decades. Go ahead, Dr. Pate.
Well, I just wanted to add on one more thing to what Allie said, because this is really important. We can take those families and we can get them housing, but back to the children again. We have learned so much more about what we call ACEs, adverse childhood events. Now, that doesn't have to be because the child was part of a homeless family. That can happen in other families as well. But the point I want to make is these childhood events that are traumatic, just as Ali was saying, these can last for the rest of their lives. They affect whether these folks will suffer from mental health, depression, anxiety issues. They affect criminal subsequent behavior. Oftentimes we find people that end up in our judicial system, they had these adverse childhood events. And the other thing we have found is at a time when we're looking at obesity, and particularly morbid obesity, often, and especially in women, we find in those patients, a staggering number of them had adverse childhood events. So this period of homelessness, we can address this period of homelessness, but the more that it is and the more that it affects them, the more it has very long-term consequences for these children. So I just wanted to amplify that point.
Absolutely. So in your opinion, Dr. Pate, how do you think, the next generation of Idahoans and Treasure Valley residents could benefit from secure housing right now, today, this year, next year?
Well, I think there's a couple points. First of all, I'm really pleased we stop criminalizing this. The idea that we're going to go and ticket people or give them fines, for living on the streets is a bit ridiculous. And so that's a good move. Another thing is that I think if we as a society think about what are smart investments for us, what are those kinds of investments that we can make that will give us returns for years? Housing's one of those. And that's why I was very proud when I was CEO of St. Luke's to partner with the CEO of St. Al's, with the city of Boise, and we funded some housing. And there's tremendous return on those investments when we get people off the streets into secure housing and in a place where you can actually deal with mental health issues, in a place where you can address their medical conditions. Oregon did a study where they addressed, and it wasn't just homelessness, it was people that had unstable housing. And what they found is it decreased the cost of their Medicaid program 12%. Can you imagine what the difference would be for Idaho if we could save 12% of our Medicaid budget? I mean, it's a lot of money. Also, those people, once they were in stable housing, they were 20% more likely to see their primary care physician and 18% less likely to show up in the emergency room. So we can decrease healthcare costs, we can decrease Medicaid costs, and hopefully we can help some of these kids reverse and change this direction of where they're headed, because all of us, I think, know that what we need, children need security and children need education. And if we can put them in secure environments where we can help develop them and get them education. In fact, one of the keys to getting out of poverty and out of this is education. And if we invest in that, and if these young people today avoid a course of being homeless, poor, financially challenged, and we can get them into good jobs, guess what? They pay more in taxes. They help the state. I mean, so these are what I call smart investments. Let's not just throw money at a problem. Let's invest money in a smart way where it actually provides a big return for all Idahoans later.
Well, yeah, it's a nice cycle as well. And your anecdote on the insulin is a good example. Not everybody needs a 6-bedroom mansion. It could be a very small cost that helps get them to the next month. So, Allie, if you want to touch on, again, you mentioned it in your presentation, how does the cost compare as for what it could be to help somebody just stay where they are without changing much other than covering their rent or helping them that exact moment, than it would be to have them evicted, have them on the streets, have them impacting more of the community than just themselves and their landlord?
Right. So the specific numbers for our community, Boise State University did a report on this and found out that every person who's homeless in Ada County costs the community $53,000 per year per person who is homeless. And that's the cost taxing the healthcare system, as Dr. Pace mentioning, first responders, as well as our nonprofit organizations. So $53,000 versus what it costs us, $1,000 on average to keep a family in their home. The cost to the family themselves as well. We know that once a family lands in homelessness, it costs them $5,000 to $10,000 to find a new place to live, with the cost of moving out, all the fees, admin fees, application fees, storage, just cost of moving in general. So definitely a big difference there.
Yeah, it's an expensive process for sure if you do have to move, and $53,000 can pay a lot of rent. So it's a good point there. So what do you want the community to know about what we can do to help out? Because we do have a big deadline coming up at the end of the month that is possibly going to affect a lot of renters. So maybe if you want to explain a little bit more about what that eviction moratorium means. We hear that phrase a lot, but what is that all about, and how can people watching at home tonight get involved to help?
Sure. So eviction moratorium is a bit of a misnomer because as staff and everybody some of our board members on this call have talked about this, we know that it hasn't actually stopped evictions. It was supposed to, but it only applies to certain tenants in certain situations, and every court and every judge is applying it differently. But essentially, if a tenant can prove that they qualify for certain criteria under the moratorium, it's been in place since September, expires December 31st. So those criteria need to be in place within those time limits. If those criteria apply, they can prove it in court. Then they can be prevented from being physically evicted in their homes. However, they still owe their rent, and the moratorium does not exempt people from paying their rent. So landlords can still file for small claims to garnish tenants' wages. And of course, some tenants, if their landlords had chose not to take the case to eviction court until January, are just incurring thousands of dollars in back rent right now. So we're definitely concerned about what will happen January 1st, kind of what that will look like for the community. We saw just 15 hearings in Ada County this week alone and tried to get involved in as many of those cases as we could. But we know that many more cases are not happening. So what people can do, obviously, donate. Any donations are going to allow us to hire more case managers to administer more rental assistance. Really, that's a key piece. You can also advocate with your local, state, as well as the federal government to encourage them to invest in rental assistance or a better or an extension of the moratorium, or even a better moratorium that will also address the back rent that people owe. Yeah.
So Allie, I do want to ask you again, in your presentation, you demonstrated how much more Jesse Tree has been able to help the community this year compared to years past. But what is the volume that you guys are seeing, and how much more are you being asked of this year compared to years past?
Yeah, so I mentioned a bit, but requests for rental assistance on our housing crisis line increased by 300% as soon as the pandemic hit, and has not let up since then. We're fielding around 500 calls a month. About 200 of those are specifically for rental assistance, and those people are applying for rental assistance. And we're able to pay rent for around 50 families a month right now, so about 25% of the need. But also, as I mentioned, we're missing a lot of people, which is one of our biggest challenges. A lot of people still are not contacting us for whatever reason. Everybody has their own reasons, but some people are embarrassed, ashamed to ask for help. Some people think they can sort it out on their own, and it gets to the point where they just can't in the end. Some people just don't know about us. So we're definitely missing a lot of people, and we hope that we can continue to get our name out there so we can reach more people and hopefully just also raise more money and serve more people.
Yes, so important. So before we move on, Dr. Pate, what do you want the audience watching tonight to kind of take away from this conversation?
Well, what I'd like to tell you is, first of all, this is a very worthy cause. Second of all, is if you contribute to this, you're not just helping keep or put a roof over somebody's head. You're contributing to the future of children. You're contributing to the health care of these folks and to keep our healthcare costs down. And you're contributing to helping us control a health crisis right now. Frankly, the last thing we need next month is for a bunch of people to lose their homes and be out on the streets in January in a pandemic.
Yeah, the weather just adds another element of challenge in there. So thank you so much, Dr. Pate. Allie, is there anything that you want to say while we wrap up this discussion?
No, just thank you both, and thank you, Dr. Pate, for your insights. This was really fun talking with you.
All right,
Thank you,
so much both, of course, for being part of this very informative discussion. So we're going to move on with the evening, help raise a little money to help out those Idahoans in need that we mentioned. So we are just moments away from that live auction. So let's check in again with our artist, Amy Larson, see how that painting is going. Hi, Amy. It looks beautiful.
Thank you.
All right, well, let's get that auction started. So joining us now is Jesse Tree's lead case manager, Nick Bogar. So Nick, go ahead, take it away.
Thanks, Karen, and thank you, Amy, for this wonderful painting that you created for us tonight. The title of the work is Healing Home, and it's an acrylic on wrapped canvas measuring 24 by 30 inches. The estimated value of this painting is $600, and so we're going to get started with the auction. So make sure you're ready to type those bids into the chat and signed into your Gmail or YouTube account so you can chat. We'll be up for 2 minutes, so I'm going to start that timer right now. Perfect. On behalf of Jesse Tree staff and case managers, we want to say a big thank you to our donors and our volunteers. You guys truly do help us keep those people in our housing. And we're fighting for that mission of ending family homelessness by 2025. COVID has been an obstacle for not only Jesse Tree, but our clients have been affected by this immensely. So, for example, I've been working with a client who we actually been able to help, who's a family of 5. The main income was from the father and lost his job due to COVID. And so we were able to provide budget planning, able to mediate with the landlord on a payment plan and get that check sent out so they can get the rent paid before the huge late fees get covered up on the client. Unfortunately, not all is great because we do have clients that are struggling even more so just by themselves, especially with female single parents. I just helped a client that I spent a good amount of time on with case management, with a payment plan where their ex-husband left with all these different fees without telling the wife and had to balance between daycare and childcare to working. And so trying to get those hours in. So we were able to help mediate with the landlord. The landlord was great and able to pay their rent as well too. So from us case managers, another big thank you from us. You really do help us keep those people in their housing. If you want to learn more about us, please go to our website or our social media and please keep tabs on us and ask questions on how you can get more involved too. And then a big thank you to the participation for everyone on tonight, getting tickets and the food. Allie, Dr. Pei, thanks again for that great discussion. We see it day to day, the real life, and it's very hard to juggle COVID and also get people to stay in their housing. So thanks for that great discussion. The time for the auction is now done. We will be emailing that winner. Thank you again for that participation.
Thanks, Nick. Thanks, Amy. Well, hi, everyone. If you haven't met me yet, my name is Hannah Sharp. I am the new development manager here at Jesse Tree. It's nice to virtually see everyone tonight, and I saw some of you earlier when you picked up your food. So it's great to see you. I just want to thank you all for joining us. And I am just here to talk at the end about our fundraising campaign, which is Avenues for Hope. It started today. So thank you to everyone who's already donated. And it's running through the end of this month, December 31st. We do have a very ambitious goal to help us be prepared for that eviction moratorium ending on January 1st and for all of the work we'll need to continue doing in 2021. So having you help us meet it is really important so we continue to house our neighbors here in the Treasure Valley. As we have heard from Allie and Dr. Pete tonight, the pandemic and the housing crisis will continue. We're definitely not out of the woods yet, so we really need all the support that we can get to serve Treasure Valley residents and keep our neighbors housed, especially during these long winter months. You can donate to our campaign on our website, which is jessetreeidaho.org/donate. And we'll also put that in the chat tonight. That link will take you right to our Avenues for Hope donate page. And any donation made will count towards our goal, which is $75,000. So any help you can provide is so great. We appreciate it so much and hope that you enjoyed our event this evening. This is our first annual event, so we will have a Housed for the Holidays event next year, and we're hoping that we can have it done in person. So thank you.
All right. Well, it's been a fun night, and congratulations to whoever ends up with Amy's beautiful painting. Congrats to you. And thank everybody for joining us virtually tonight for Jesse Tree's Housed for the Holidays event. As promised, we're going to leave you this evening with a little more music from that local jazz band, Kitchen Syncopation. So good night, everybody. Have a great night.